Everybody, as we are assembling here and the participants counter starts ticking, we'll get started since it's 1 o'clock. I'm Carmen Shepa, Dean of the Bouvet College of Health Sciences, and I'm very excited to welcome all of you today to the webinar series on women who inspire at the forefronts of healthcare. Today, we will engage in a discussion about the impact and leadership during the early days of COVID-19 and the critical call for personal protective equipment, PPE, for healthcare professionals from around the globe. We invite and encourage all of you, the audience, to ask provocative questions to generate great ideas and exchange. Before I introduce the participants, the speakers, and moderator, I'd like to thank the Planning Committee for today's webinar, and I would like to ask our colleague Crosby to just give us some logistics about it. Please, Crosby.
Thanks, Carmen. Welcome, everybody. As we settle in, we just wanted to share a few best practices and notes for this event. We are recording it, and the recording will be circulated afterwards. If you've joined from another device, such as a family member's iPad or iPhone, we ask that you please rename yourself, listing your first and last name, just so we know who's attending today. If you'd like to raise a question or a comment throughout the presentation, please use the chat window. You can type your question or comment there at any time, and we'll address it during the Q&A portion towards the second half of the event. Our moderator today, Dr. Valeria Ramden, will be reading out the questions in the order that they're received, and when your question or comment is raised, you're welcome to unmute yourself at that time if there's anything you'd like to add or you'd like to follow up on. As a courtesy, we ask that you please remain muted throughout unless it's your time to speak. You're welcome to leave your webcam on for the duration. It'd be great to see everybody's faces, however you do not need to. And with that, I will turn it back to Dean Shepa and our presenters.
Thank you, Crosby. So I am delighted to introduce our speakers today, Rebecca Love, nurse entrepreneur and co-founder and SunSeal, and Hannah Rosenblatt, co-founder of Masks for Massachusetts, both alumni from Bouvet, but Hannah just recently graduated. So I will let Professor Valeria Ramden get us started and so that our speakers can introduce themselves more fully. Welcome, everybody. Enjoy.
Thank you, Dean Shepa, and welcome again to everyone joining us today for this third in the series of Women Who Inspire at the Forefront of Healthcare. We are planning a very exciting hour, and for the next 35 to 40 minutes, I invite you to be captivated as these two speakers tell their story. But before they tell their story, I just want to take a quick pause and let Hannah Rosenbach, who you've just heard, a recent graduate from Bouvet College of Health Sciences 2020, just introduce herself in a brief 2 sentences. Hannah?
Hi, thank you. I really appreciate you guys having me. My name is Hannah Rosenblatt. I just graduated Northeastern in May. I say graduated, but we didn't really have a graduation yet. But I majored in health sciences and I minored in math and business administration as well. And I also played on the Division I varsity soccer team while at Northeastern.
Thank you, Hannah. And then we'll turn our attention to Rebecca Love, who is I would have to say stranger to us. Rebecca, just introduce yourself briefly for us. Thank you.
Thank you, Dr. Ramden. My name is Rebecca Love. I am a graduate of Northeastern in 2008 from the School of Nursing with a master's degree in nursing, would serve as a nurse practitioner for at least a decade. I currently am the president of SunSeal, the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, which is a nonprofit established in the United States and also with collaborations in Canada and the United Kingdom. And in my full-time job, because that is only a volunteer position with a whole bunch of other rock star nurses, I serve as the vice president of customer strategy and success for a company called OptimizeRx. Thank you.
Thank you very much, Rebecca. So as you have heard, they're here to tell their stories of PPE. And for most of us, we have heard or have experienced PPE as personal protective equipment. And you've heard of that in social media and everywhere else. But I'm here to tell you that PPE means something different, at least for this 1 hour. It's about the pandemic. And from the pandemic, there was another P, the pandemonium. And then there came the E, the engagement to make a positive impact. So before we go further for them to tell you about the pandemic, pandemonium, and engagement in their lives, I have one disclaimer which you heard Dean Shepard alluded to. We are all Northeastern grads. So perhaps there's something about educating and being educated at this great institution, Northeastern, that inspires us for action. So we're gonna start first with Hannah Rosenblatt, who is on, I have to say, the beginning end of the leadership spectrum. And Hannah will lead you to tell your story of Mask for Massachusetts.
Thank you. So like all other Northeastern students, I had to pack up my things in mid-March and head home. And I wasn't home for even 48 hours when my dad, both my parents were surgeons. My dad still works and my mom recently retired, but kind of was helping out administratively at the hospital she worked at during all of this. And he came home, or watching TV, eating dinner, and he's frantic and he's like, "We need masks." And I'm like, "What the heck?" And mind you, this is a few weeks well before the big movement to have everybody wearing masks, and even before the major shortages that we had seen in all of our hospitals. So thought he was a little crazy, but my two siblings were also home. It was the first time we were home under the same roof in quite a while. And we posted it on different social media platforms. I posted it on Facebook, and my sister posted it on a local website, thepatch.com, just kind of town by town. And then my brother asked somebody else in town, and we kind of gave, here's our email address. And then within hours, we had hundreds of emails, and we were quickly overwhelmed because my dad initially asked for 3 sewers, and we had over 300 within a few hours. So it was really overwhelming. And in the midst of that time, I quickly found a pattern on Pinterest, which is one of those craft websites, and I have no sewing experience whatsoever. I cut out 2 templates, and I sewed a center stitch and said, "Hey Dad, how does this look?" And he was like, "That's great." So many different moving parts, but within 24 hours, we had a Google form, which was just a form where we could collect everybody's contact information and kind of their skill set of if they could sew, if they were interested in being a coordinator for us once we kind of got down the line. And within 24 hours, we had over 3,000 responses on that. And we got locked out of our form. We had so many different hurdles that we just kind of had to make a lot of pivots really quickly. So we made a Facebook group, and we have over 4,000 members, and that was kind of the central place where we were gonna give updates on our project and on our progress. And we also started a GoFundMe, and we raised over $13,000. So where did that go to? We partnered with Joann's Fabrics, and they actually created a template and a video and an instruction manual on their website, and they were supplying us with a lot of fabric, but we had to buy a lot of other things. So our kind of model was, none of us know how to sew, but we have all these people who do. So can we get them the supplies that they need so that they can kind of go to town and make these masks, and let's keep supplying them with fabric. So it's kind of this organic process and really grassroots. I was cutting all of the fabric in my basement for weeks, and just cutting it out and cutting out elastic bands for people as well. So what we would do is we would have an organizer in a town, and we would get them kits. I say kits as in they had a yard of fabric, the amount of elastic they would need, and some yarn, some thread, and we would get it out to them. And then once all of those were completed, we would pick them up from the coordinator. And we kind of were doing this for a few months, and we would deliver these masks to hospitals, recovery centers, grocery stores, some homeless shelters as well. So it was just really this organic thing that kind of came about just because my dad said we need masks, and my siblings and I were all in a position to do something. And we might not necessarily known exactly how to do it, but as we were doing it, we kind of learned all of what we needed to know and kind of just did the best with what we could, which I think everybody has been trying to do during this situation.
Well, thank you, Hannah. Thank you for your insight and for giving us a little bit of, I have to say, from your interest to Pinterest story and moving from the 3 to the 300 to the 3,000 people of interest. That's phenomenal. And now I want to kind of take your attention to the other side of the spectrum. And we do know that in healthcare, 70% of the workers are women. So there's no secret that we have two great women at the ends of this spectrum. And I say at the end because there is not saying that Rebecca is at the other end. I kind of think that she's somewhere in the middle. She's got a lot more ground to kind of cover. But I'm going to turn the attention to Rebecca right now to tell us her story. Thank you.
Thank you, Hannah. That is so great. I love that story. And it was around the same time. It was the weekend of March 13th, March 14th, when all of a sudden I was on Facebook and I started to see posts of nurses across Massachusetts saying, hey, does anybody have an N95 mask? The hospitals are holding them. We don't have any. We're seeing COVID patients. We're being told we can't use the mask. They've all been removed from our floor and locked up. I'll come to your house and pick up masks. And at that time, there wasn't anybody in the media talking about a shortage of masks. Now this, if you guys aren't nurses or on the front lines of healthcare, this is shocking because we've never had an experience in healthcare where you couldn't get access to PPE. And in fact, what really happened is we would get written up if we didn't have PPE. So this idea that you would be going into a respiratory illness potential room without a face mask was counter to everything we fundamentally knew about infection control in nursing. But what was weird is that we couldn't find anybody actually talking about this. And when I brought this, so Santiago is a group of nurses from around the world who made up a volunteer organization, but my board is smart. I have former senior consultants of Deloitte. One of our founding members and board members is Ann Corcoran, who runs AMC Healthcare, who I know was on this program a couple months ago. It's the director of innovation at University of Pennsylvania. These people, it's the Hiam Nadell from Massachusetts General Hospital, also a graduate of Northeastern University. These are my board members. And I thought to myself, oh my gosh, are we going to listen to nurses' posts on Facebook to validate? Because we started to call the hospitals like, hey, are you guys having a shortage of PPE? And they said, oh no, we don't have any problems. Everything's fine. Everything's fine, right? So I got together our board meeting on March 16th, and overnight, the board came together and initiated something called the SHARE program, Strengthen Healthcare's Ability to Respond to Emergencies. And simply, we called the SHARE program a call to action that we would collaborate and organize donations of PPE, specifically masks, that could be picked up at our front door or around the country. And one of the first people that I called was a man by the name of Dr. Jonathan Levine, who was a dentist, and I know Valeria knows him because we went on a medical mission trip with him and his group to provide dental care down to the Bahamas. And I said, Jonathan, I have all of these nurses telling me they don't have access to PPE. All the dental offices are shut down. Can you help us coordinate a movement to coordinate all of these donations? Long story short, in the course of a week, we had activated donations from around the country to get to major hospital systems. What we didn't realize, though, was that hospital systems didn't want to, one, admit there were shortages, and two, supply chain directionals weren't willing to necessarily accept donations of PPE easily into hospital systems. In the course of the last 4.5 months, we moved over 300,000 pieces of PPE, raised donations of $100,000, and are closing out our final donation of 80 hospital systems with the mass donation of Massachusetts manufactured masks at the end of this month, because we ran out of donation and runway. We made all the money that we could. The reality is, though, today we are again seeing an elevated and cries for help that PPE is facing numerous shortages across the United States. The 6th largest medical manufacturers in the world have just written to the presidents of the United States saying there is no longer raw material available to make PPE. And those on the front lines today are still facing dramatic shortages, reusing masks, and stepping across a threshold in which most advocates and healthcare specialists are saying this is an airborne disease. And if you don't know this, the risks to our healthcare professionals on the front lines are at the risk of 12 times greater risk of contracting COVID-19 than anybody else. And we've had over 900 healthcare providers die in 3 months' time in the United States alone from contracting COVID-19. The issue of PPE, the issue of an N95 mask, it's more than a mask. It can potentially save the life of a clinician. And right now, we are sending our clinicians in to manage a crisis without the supplies to keep them safe. And the issue of why we took action was because when nurses called for help, we realized that if we as a nursing organization didn't hear them and take action, How were we going to keep anyone safe in this crisis? So that's our story. And Valeria, I'm turning it back to you.
Thank you very much, Rebecca. So now that you've heard, I have to say, the basis of their stories, you've heard just now, it was not only the need for the N95, there was this hiding of they don't have enough resources. It's that false sense of security that we are falling and we are crumbling. But little did they know that all across the globe, the same thing was happening. I have to say, in this World Health Organization declared Year of the Nurse and Midwives, nurses have never worked so hard in their lives in order to actually keep people alive. And for that, we have to be thankful. We've come out of the classrooms where we talk about, practice or industry. We talk about research. We talk about innovation to a less extent. So, but now we have to start thinking about it. You've just heard two speakers articulate the creativity in terms of mobilizing resources. And the technical and the scientific pieces we haven't heard a lot about because it moves so fast. But you've heard process and problems and concepts and pitching and pivoting, all of which we actually have to kind of have like on the tip of our tongue when we have to be saving lives. Rebecca just mentioned, nurses and healthcare providers are 12 times more likely to contract COVID and die while they're trying to save others' lives. So the question for us is, what are we going to do about it? How are we going to mobilize? So let me turn my attention to the chat, and hopefully you'll have some opportunity to enter your questions or comments, and we're going to address them now as we go forward. So the first comment is around how are we to share group information around SONCL. SONCL, which stands for the Society of Nurse Scientists, Innovators, Entrepreneurship, and Leaders. And I'm going to have Rebecca tell you a little bit more about that organization.
The whole foundation of SONCL came largely from just the experience that I had at Northeastern and with the Nurse Innovation Program. What I always had found when I was a nurse was that I didn't fit into the normal paths of nursing, which was if you were going to become a nurse, you become a nurse practitioner, you go into education, you go into research. And what I found is I wanted to do something different. I created my own company. It eventually got acquired. I've been on the business side of healthcare now for almost, I would say, the last almost 10 years of my life in addition to practice. And what I found is I wanted to take action. And what I found in nursing a lot is we formed a lot of policy. And when I watched what was going on, I met all of these incredible nurses who had walked different directions. But what they had done is a lot of them had stopped identifying as nurses. They went into the world of business. They existed out there. There's the chief nursing officer of Microsoft, Molly McCarthy. There's the head of the chief nursing officer over at Cleveland Clinic, who is Nancy Albert, who recently, because of the work of what we started, just got a new title now as the director of nurse research and also innovation. So the idea is how do we create a group, an organization that empowers nurses to not only brand themselves to each other in the next generation, but tell the world what nurses' value is in healthcare. Because as many of us who are nurses have often used nursing as an adjective, it sort of describes itself, but we've done it very poorly. So because of that, our ability to transform, to really drive changes and have a seat at the table, didn't have necessarily that foundational organizational structure of business strategy and operations to have the conversations to move healthcare forward, because we couldn't speak the language to the business of healthcare. So SONCL brought together the leaders and other verticals of nursing that had walked on the edge. They had seen life differently. They had started companies. They had started associations. They had been consultants. They had built companies. They had sold them. And they have all made a demonstrable impact in some way in their lives. So we became an affiliate status to the United Nations, one of 3 organizations to put nurses on committees at the United Nations. In the course of 3 months, we wrote a book called The Rebel Nurse Handbook, which was the first time Springer Publishing ever wrote a book with 47 authors and published it in 6 months. We initiated the SHARE program. We did the first global hackathon with Microsoft and Johnson & Johnson during the COVID crisis. We started monthly nurse meetups for nurses from around the world to talk about what they were seeing on the front lines. The idea of SONCL was about driving action and impact and elevating the role of the nurse so that they could be seen as CEOs and directional operational operators within the world of healthcare. And that was the goal of SONCL.
Well, thank you for that. So now you all heard a lot about SONCL, and that's fantastic. And we do know that nurses are at the forefront. They work well, I said we work 24/7, but we can't do it alone. There are a lot of other healthcare providers in the field. And I'll take another question in a short, brief moment. But one of the things that came in was Lisa Baker wanted to know a little bit more about your organization's strengthen healthcare ability to share, which you just mentioned. But I want to pause and ask Hannah to tell us a little bit more about the hurdles. She mentioned that there were some hurdles. So I want to know the hurdles and the lessons learned, because others that are in the audience may actually be also interested in doing something similar, or even helping out, and they may be able to actually learn from your mistakes. Go right ahead, Hannah.
Absolutely. I think that this is a fantastic kind of parallel. Rebecca has this well-established organization that can kind of pivot to whatever needs that we currently have with COVID. And we were starting from our basement. So I think that that's kind of an interesting parallel. And I think the initial hurdle, I think all the hurdles kind of stem from this was started so quickly because it needed to be. There was such urgency. And I think that one of the main hurdles was, how do we get everybody on the same page, and how do we communicate with everybody as effectively as we possibly can? And we had some hurdles just in that, and we initially thought, oh, we're going to get a few people to help us, and we're going to just email them. That quickly became, no, we can't do that. So we tried to get their contact information via Google. That didn't work because we can't email 3,000 people like a couple times a day to give them updates. So we said, let's go to Facebook. And that was kind of the first lesson hurdle we learned. That we kind of finally got it right almost. But I think that in this whole process, you learn that you're not going to get it right the first time. But especially in this crisis, whatever you do to help is gonna help. So you don't have to get it right the first time, but as long as you get it right eventually, you're gonna make the most difference. I also think that we had some initial struggles with, honestly, I had some struggles back and forth with my dad. This was before the big masks are gonna help us all. We should all be wearing them, which is now very, very accepted, especially up here in the Northeast. And he said, we need to get research, we need to figure out the best material to do this with, and we need to secure all of that. And I kind of came into being kind of a co-founder of this organization. Now, my dad called me to action, but my siblings and I we formed what this was gonna be. And I pushed back. I said, masks, we're gonna need masks. I kind of foresaw the future. I said, we're gonna need them, someone's gonna need them. I can't wait weeks while you do research to figure out whether this material versus that is going to be the best. And so I think that was kind of a big step for me to kind of come into my own and kind of push back, even if it's against my dad, that, hey, this is how it's going to be done. And we're going to kind of go with that. And I think eventually we did do the research, and we kind of found out that masks were going to be very beneficial, but that was when all the other research was kind of coming out. And we wanted to get masks to people as soon as possible when they needed them. So I think that was another major hurdle. And I would say, lastly, just kind of overall, I think my biggest lesson I learned, kind of just to reiterate, is just that you just have to, I was called to action. And I put that into motion, and I stopped sometimes at night and said, like, I could have done this better, I could have done that better. But in taking a step back into the larger picture, you can see that you're making a difference. And I think that was always the thing that I needed to come back to. So, yeah.
Oh, perfect. Thank you very much. I think some of the greatest, they have all learned from their falters, and I don't think anyone gains successes and be able to expand in their knowledge without those steps, because it's from those steps that make us strong. But there is a comment on here wondering, what is the current state of PPE shortage, standing for personal protective equipment? We are all hearing, talks about what's happening in California and Texas and Florida and Arizona. So definitely there is still a lot of need. If you just turn on the news any single day, you do know that this is not something of the past. This is something of the current, and there's a lot of very morbid projections for the fall. So yes, there is still a whole lot of need, and there will be some specific numbers, I think, depending on which agency you link into. But the research is still there. The need is still there. Innovation is still needed, and we still need all hands on deck. And then we have, Rebecca, just tell us a little bit about your Strengthen Healthcare Visibility organization, briefly. Thank you.
So SHARE was basically, that was our initiative. We basically said at that moment, we put a press release out and we said, we need people to make donations. When we ran out of donations, we had received several, we had received about 30,000 pieces of PPE and moved them across 8 states in that first week. And that was when Nightline ran a story on what we had organized. That's when we ran out of people making donations, because the PPE costs money and prices went up dramatically. So one of the questions that you have, are we still having shortages? We went and we started to raise funds, and we started to raise funds to purchase PPE with going overseas to China. And what you guys have probably been seeing is that we're dealing with a global issue with China right now on trade, and numbers were coming down. And what happened is what we don't produce PPE in this country. Our manufacturing abilities in the United States are slim to none. And 3M was the largest manufacturer of those in the United States, at which point was exporting a significant number of masks abroad as well as maintaining internally. The shortages were dire. They've started to catch up in the summertime, but the problem is that we have a global shortage of both material to make PPE. So we're no longer just facing shortages of N95 masks, but literally we can't find gloves anymore. We were just expressed that there's no longer going to be the ability to wear gowns anymore going forward. The shortages are significant and they are getting worse. The reality is, what we also learned is why, when we had these donations, that we wanted to get them into hospitals, we had to make them as a donation, but there was things that control healthcare's abilities to purchase hospital systems regarding something called a GPO, which is a group purchasing organizations. Hospitals have these agreements with group purchasing organizations, and if they were to go outside of that purchasing one, they would be sued for violating contracts. So you had this complete conundrum where GPOs weren't removing the contract barriers to purchase PPE in other capacities. Then you had the Wild West of basically the federal government at points was not stockpiling, or they were seizing orders of PPE coming into the country. Right now, today, there is not one hospital institution. We have 4,500 hospitals in the United States who is well stocked with PPE, more than a 30-day supply going forward. There are significant challenges to the point that we are reusing N95 masks, that the inventor of the N95 mask has come back out of retirement to try to develop a new N95 mask. And why this is important is N95 masks are the only masks on the market that prevent the spread of airborne infections, which we know is soon to come is what is the kind of level of contamination of COVID-19. The reality is, on the front lines, most nurses in the best situation, most providers in the best situations are getting 1 N95 masks per shift. The worst situations, I'm hearing that they are using them for up to 3 weeks. The reality is that PPE shortages, the current increasing trade war with China, and the lack of the ability of manufacturing in the United States has me greatly concerned that the fall and winter months going forward to us are going to leave our front line severely unprotected going forward. If you reopen schools and demand the same kind of level of PPE to be presented to professors and students, you equally will shorten the supply that is available to the front line. Right now, we do not have what is needed to sustain our healthcare workers. When we go into a spot where we open up the rest of this world to try to manufacture and support the economy and give everybody a mask, we are fundamentally going to fall short, and we are going to lead to further spread and destruction of our healthcare workers on the front line. So in my opinion, until we get a federal response, an organized federal response to address this issue, and an organized, sustained movement and tracking system of PPE in this country, our healthcare workers are in serious trouble.
Thank you, Rebecca. There's a lot of thank yous that are coming in. We have a thank you from Dean Van Pelt for your vision and leadership to both Hannah and Rebecca. And Constance also says a thank you, but one of the things she wants to know, and you alluded to that just now, Rebecca, with the GPO information and the hospital's contract barrier and the legal implications of it, that many institutions take time to adapt, and most of them are not flexible. And she wanted to know, what steps you had to do to promote the innovation and change, especially as major hospitals don't want to accept donations. And if you can talk about the specific steps that you made. And this could be for either Hannah and Rebecca. Please share.
I can just kind of share. I definitely had some hurdles and some troubles with that. Even just the institution my parents work at, there's this embarrassment to not accept masks albeit ours weren't necessarily technically PPE, they were more cloth masks, but there was hesitancy because they don't want to admit that they don't have enough masks. But our whole country, every institution, our national stockpile didn't have enough masks. So I think once you got a few weeks more into the trouble, kind of those rules kind of were a little more lax, and then they were accepting them. But we definitely had some struggles with just institutions not being really hesitant to accept help. And I think that was kind of the biggest thing. I think Rebecca might be able to talk a little bit more to getting past those hurdles with a lot of PPE, so I'll let you take it over.
Anyway, it's Hannah, to your point, what we did not realize how hard it was to get donations and supply chains. So the hospital systems have they have a central purchasing office for any hospital system, and these supply chain orders are controlled not by the clinicians on the front line or even the administrators. They're supported by a very small department that maintains very strict control over what products can come to and into and out of. So testing of the products that we were being sent in was very important. So we knew that from a very baseline, we had to get a contact in the supply chain department of purchasing. Next, we had to send an order large enough that they were willing to actually test the product, because what we ran out of was an N95 mask ran out even before the beginning of March. We had to move into a purchase of what was called KN95 masks, which had been created in the Chinese market, and then the market was flooded with basically poor suppliers of KN95 masks. So we had to basically go off of this trust system that they would do this. What we did is we launched this international campaign. We had some friends of high up. One of the people I can give a shout out to, David Chang, former CEO of PayPal, came in to start supporting us, contacted us, and we ran basically a national campaign across television stations, thanks to AT&T, Xander, a man by the name of Doug Hurd, and Josh Summers, basically gave us free time on air. They ran a 30-second campaign for us across televisions across the country to say, if you need PPE, if you want to connect with these individuals, do and go here. So they pointed them to our website. They collected it. We had over 500 hospital systems get on there and put in their request. And that's how we started to get it, because we asked for the supply chain contact. That's how we had to do it. We had to break it down. Hospital systems today, I think we're hoping that their supply chains were coming on. They're being prepared. They started to reallocate resources to support the supply chain mechanism. The states have really been, and I can only say I am really impressed with our governor in the state of Massachusetts. He's done a fantastic job doing that. We actually were invited for a phone call with Mrs. Baker, who got on the phone to sit there and say, thank you for what you're doing. Keep going, because we wanted to wind it down. We actually worked with MIT to get over 80,000 of their face shields when they brought to market, because they couldn't even get their masks or their face shields donated, accepted into places. We became this middleman, basically sitting between the hospitals and the organizations that wanted to donate and get their masks out. But that's the reality of the situation. I don't think that we're going to see a substantial change in current purchasing structures by hospitals anytime soon. As you guys know, crises are the moments of innovation, so you hope that maybe some good will come of this. But currently, I would probably say supply chains is one of the biggest concerns on the radar dealing with healthcare. Not only healthcare, though, basically across the world and country right now, we're seeing supply chain challenges, and it's no different in what's facing on in the hospital system.
Absolutely. The messages cannot be more clear. Someone asked in terms of what the R and the E, but for those of you who did not pick it up, for Rebecca's organization, the SHARE stands for Strengthen Healthcare Ability to Respond to Emergencies. So of course, notice it didn't say COVID, so hopefully it'll live beyond the COVID, because the need is definitely greater. There is one question / comment that's coming in. And of course, after a thank you to both for their stories, that, this is from Cara Dalton, that she's struggling to get students into the hospitals for clinical experiences as a direct result of the mask shortages. We do know that there is some more beyond the mask shortages that has actually prevented some of our students from getting into these facilities. But the question specifically asked is, do you have thoughts on how we can safely and effectively combat these challenges? And I think that those challenges perhaps are greater than this conversation today, but I'd like for the two of you to maybe take a little stab at what you were hearing as they were actually pushing back on you, if you heard anything about, students entering the workforce. Because we do know in terms of resources is a little bit more than materials. Sometimes they may not have the human capacity in order to deal with the crisis when they are not particularly or specifically trained. So I'm just going to open it up to both Hannah and Rebecca, if you have any comments on that.
Do you have thoughts on that, Hannah? Want to go first?
I have one friend that she is a second-year nurse at BI, and I know that she struggled in the beginning of this. She was on the COVID unit, and she goes, I am now training other nurses that were just hired as a first-year nurse. And that really, I got taken aback because I've talked to her plenty in the past year over her first year nursing experience and just trying to soak all of the knowledge in and just kind of learn, and then flip to COVID, and she's now teaching someone else, and just I saw the stress on her face. That it's the resources, I think, are the resources of those who are going to be teaching those skills, is that we're having these other first year nurses teaching other assistants kind of the ropes in a really, really stressful time. So I think that's definitely a challenge. And I think in the present, I'm not totally sure of the teaching resources, how we can kind of mitigate that so that we still can get our students into hospitals to have their clinical experience. That's definitely going to be a challenge.
Mm-hmm. Thank you for that, Hannah. Would you like to add anything to that, Rebecca? Okay, thank you for that, Hannah. I think as we heard your two stories, there were definitely some people within the community that were very helpful. And if you can speak to some of those groups that were helpful, did they just help because they had that desire to help, or did they have some connection in terms of whether it was healthcare, nursing, or other stuff? Let's start with you, Hannah, again.
Yeah.
Which groups helped you and your organization? Not individual people, groups.
Yeah, so we initially were trying to get material and kind of went through my parents. My dad and I had gone to Joann's Fabrics and said, this fabric looks great. And then he goes, we need all of it. And not necessarily all of it at that store. We needed all of it in the area. And so I initially thought he was crazy. It was another call to action. Like, how are we going to get all of the material that we need? And he did some digging and did some research and found out that the Joann's Fabrics, his wife was a healthcare professional. And where do my parents have connections? In the healthcare profession. So my mom sent off a few emails, and right from the get-go, they were willing. They said, take whatever you need for free. And we went to so many stores, and they had kind of their regional managers saying, this group is coming, you give them what they need, you kind of take inventory of what they take and let them walk out the door. So that was kind of the first big kind of group that definitely helped us out a lot. And I think that was just huge to be able to kind of get us off and running. And then also we kind of had these talks with other people that kind of might know how to start something from the ground up, even if it's not healthcare. So we talked to some people on the phone, someone who had worked at Calvin Klein, and kind of said, hey, what do you need for material? And sending us any and everything that they had that they know kind of might not get used for that reason, and said, if you can use it, if you think of any reason you can use men's boxers, you can have them. So we took off the elastic band from the men's boxers and we made face shields out of it. So it's just kind of this really organic, innovative process. And I might not have known to kind of make those face shields with that elastic if that large company had not helped me and kind of sourced me that material. So there's just so many different players in the process of innovation that kind of, you think, okay, make this, but you need the idea to kind of get outside the box. And sometimes that kind of comes from another company.
Yeah, that's actually great stories. And we won't tell some people where their mask came from because they may not want to wear them. But in all of this, you hear things around collaboration and communication is vital whenever we have to do innovation. And I think it's really brilliant that people came from all walks of life, especially if they had some connection to healthcare, because we know at the end of the day, especially with the projections, that everyone will be impacted If they themselves or their family members are not impacted, perhaps their neighbor or someone else they knew that they worked with, peers or otherwise. We all actually at a point where we are stand to be touched by something as big as this pandemic. Rebecca, would you like to add to which groups helped you? We heard the group out of New York. Any other groups helped in terms of your organization?
Yeah, so Santiago didn't have its nonprofit status. Jonathan was nice enough to collaborate with us for Glow Good Foundation, which had it established 501c3 in our tax account. And then somehow with the IRS shut down, the only time I'll give a shout out to the IRS, rushed our official 501c3 status through so that we could get our 501c3 status, which was amazing. MIT, as I said, came to us and helped the polymerase collaboration, came to us and said, hey, we have 80,000 masks, nobody will take them, can you help us? They stepped forward. And lobbyists stepped forward. I didn't know that we were going to need a lobbyist to do all of this, but a lobbyist stepped forward and said, hey, I'll help you navigate. We had got our program all the way in front of Kushner in the White House, and as you can see, they didn't want to take over managing the entire federal plan, but we had an entire plan that we wanted to put forward to the federal government on how to manage supply chains and how to start moving supply with an entire app that we had built in partnership with a large consulting company who stepped in and built it overnight to basically show where was supply and where was it needed, but it never got rolled out on the federal level. So every time something seemed to happen, it seemed to fall apart. We just kept going every step on it. And to somebody's point before, what is the issue that we're going to face with students getting back in the front lines? The issue is a different level of liability. Essential workers have basically been banned from suing their employers if they contract the virus. Nurses and them cannot do so. There's a different relationship between schools and students if they were to go on site and contract the virus. Is there a legal responsibility to keep students safe differently than what you're doing on those front lines? So I think that is a fundamental issue that we're facing on that. And the institutions are saying they're not supplying the PPE so that the students can go on to it, so that institutions themselves have to supply that PPE. It's a world that's totally uncharted territory. The truth is I think that there's going to have to be a way forward. I don't know how you keep anybody effectively in this situation moving forward and how you get students on the line, but I literally think you're going to have to deal with your legal correspondence. I'm not an attorney, but my guess is that's why you're getting pushback from these institutions, because they're scared that you're going to step in and all of a sudden 12 nursing students are going to be reported coming down with COVID, 3 of them dying. What kind of liability does that expose you to? Fundamentally, I know that's the elephant in the room. Sorry to call it out there, but that's something I think we should all be paying attention to. This is not, what we are facing today is the most deadly pandemic we faced in 100 years. At what level of risk do we introduce our students, our healthcare professionals to that are in this situation? I don't know the answer to that. I don't think that when you are now facing, my job as a nurse is to protect my patients. When you're facing a situation where you potentially, and I know we do this anyway as nursing students, you deal with HIV, you deal with MRSA, you deal with all these ones. This is slightly different if we don't have the supplies to keep them safe. Fundamentally, I struggle with it myself, and I don't know the answer to that question. So it's something I'm glad I'm not sitting in your guys' shoes to navigate that.
There are some answers that we probably will never have, especially even as this COVID evolves. We will never know it all. But you actually just pointed to something. It's a good segue to the comment that Beth Pitts asked. And it was that nurses have lost their jobs because they've made public the fact that PPE was not available to nurses at their hospital. And we do have one nurse out in New York who continues to be at the head of the nurses union trying to fight just this. And we do know that as a group of healthcare providers, not only nurses now, we can no longer sweep this under the rug and feel that it's okay. People every day are dying in the hundreds, and people are affected by the thousands. So we do have to stand up for what it is. And these are 2 women who have stood up to help make a difference. And maybe for others, the difference that they make and the positive impact that they make may look a little bit different. So we all just have to figure it out together. And if there are any leaders on the call who may have some idea to share with the group, I'll be more than happy to field that for you. But I'll move right on to Lisa Bakers, and she's our medical students having difficulty obtaining PPE. And I don't know what kind of a question is that, but it is a very interesting question. But for a long time, you know, of course, it's always been silos in terms of healthcare providers. We may have the social worker in one area, the medical students in another area, or the physicians and doctors. We'll have the nurses in another area. We'll have the physical therapists in another area, the respiratory therapists in another area. But what this pandemic has taught us is that we can no longer live in silos. So the availability of PPE is not just a nurse's problem. this is actually a healthcare problem. It's a systems problem. And it's something that all of us have to be considerate about. So hospitals know they can't kind of, stockpile and just give it to the doctors or medical students. It has to be shared across the board. And of course, maybe at some point we may never know it all, but I'm sure that some of these stories will come out. Now, moving right on to the next one. Despite this pandemic, by Jacqueline Jane, how can there be such a shortage when hospitals require billions of dollars to operate? Are there any CNOs, CEOs, COOs on the call that might want to take that one? Go right ahead, Rebecca.
So what we learned is that hospitals, so example, the Mount Sinai came out with a report that they had spent something like $40 million on PPE in the first 3 months of it. So the average use of PPE cost hospitals their entire annual budget in the course of 3 months. That's how much PPE we were going through. So although there was billions of dollars to operate, we had never seen this kind of level of use going on into our hospital system, because when you ran a code, the amount of PPE that you needed, the nursing, the staffing, and everything that's going into it is just such a high level that the hospitals didn't take it. What we're fundamentally seeing, and I just had a meeting with the chief nursing officer of the American Hospital Association, she's a girlfriend of mine, and what she told me is that the hospitals are losing an average of $50 billion a month. They're facing a grim to poor forecast financially for the next 12 to 18 months in hospital systems, because without doing elective surgery, there is no financial money coming into hospital institutions. This is a fundamental problem. But the challenge that we're facing fundamentally going forward is, as we look into this crisis, is how are we as a society going to take responsibility for making sure that we continue to do what's right so that the people around us are going to be safe? And I think that's something that we need to look at more, that we can no longer depend, because the truth is, our hospital is no longer our last defense. We are our last defense at this point in time. And it's going to take all of us being much more better advocates out there in society to own this as a disease process and as a public health crisis, to basically make sure that our hospital systems can try to keep those that are getting sick alive. And right now, the statistics are showing that if you are intubated with COVID-19, your chance of death is 86%. These are horrible statistics. The actual death rate reporting is a 4% death rate of everybody getting COVID-19. The numbers coming out are astounding of what's going on. Not to mention, the most recent study out of the European Union shows that 50% of all patients, regardless if they were symptomatic or not, are having changes within their lungs and actual damage to their heart. This is a serious condition with long-term implications for our society. So anyway, those are some of the thoughts that I have on that. Hannah, what are you thinking?
No, I don't have all the answers on all the money issue, but I mean, you've heard in the news that hospitals are just losing money, like left and right. There's no elective surgery. There's all of that. And I think that we need to get to a place, as you were saying, as a society, to wear a mask. We wear a mask. We mitigate the problem when we reduce the strain ultimately on our whole healthcare system and everyone who works in the healthcare system. And I think that if we fundamentally get to that place and can understand the role that each individual plays in this, that we can get to a better place in a quicker time.
Thank you for that. Hannah, of course, you're on I have to say, the early end of leadership spectrum. And one of the participants think you are very inspiring and wondered, how has this experience changed you as a person and as a leader?
Thank you. I would say I played on the soccer team here at Northeastern, and I think that I became a leader in that own sense there, and I played sports growing up, and I think there's a leadership aspect from that. But I think that taking a leadership aspect in a crisis is a totally different animal, right? You kind of have to really get out of your comfort zone really quickly, because the whole situation is uncomfortable. And I think that that's kind of the biggest thing I learned, is that I need to get forced out of my comfort zone and kind of grow into what I'm doing. And I think that Northeastern provided me like a fantastic platform just to do that, because you get pushed out of your comfort zone every day, whether it's on the soccer field. That was kind of a whole part of my life, and I was kind of used to that. But it's not just I'm pushed out of my comfort zone, I'm meeting new people at school. That's every college student has that, but it's I'm entering the professional world while I'm still a college student, albeit on a clinical or co-op position. And even throughout the whole interview process, you're pushed out of your comfort zone. So I think Northeastern provided me this all-encompassing and unique experience to get out of my comfort zone. And that ultimately helped me in my Masks for Massachusetts like endeavors. It really helped me to kind of put all of those things that I learned at Northeastern into an action. And I think that was really gratifying to do.
Thank you for that response. And we've heard it over and over that we will not have PPE. And I think that some folks are actually, Lisa Baker said, we're really concerned because people have to reopen schools shortly, or public schools are due to open soon. And do you think that we'll have enough of the PPE in time? And I have to say, all indicators are probably not. And we can only talk about supply and demand. Here they are looking to supply and demand in terms of within healthcare institutions. And maybe there's going to be another entrepreneur that will probably have to do it specifically for schools as schools are about to reopen. We still have about 2 months. So maybe one of you on the call might be one to be arrange the third organization. And I'm certainly that some others will probably want to join you. Move right along. There's a thank you to Rebecca for talking about the ethical implications and the elephant in the room, because it's really important and it's a complicated matter, and she just wanted to make that comment. So thank you for that. And they do agree that with this pandemic, healthcare will change. And there is no doubt about it. We are looking at best practices that are changing. As nurses, we were taught when someone is having difficulty breathing, you sit them up and you have the oxygen on them. Now with some of the best practices, they're lying the patient prone because that's having to drain some of the secretions from their lungs. That is going to change. So that's just one little area that has changed, or one little aspect have changed. A lot of the concepts that we have learned is probably going to be turned upside down for the better. So we have the virus that is mutating, and every time it seems as though they're having a little bit of levity or clearance towards vaccinations, there's something else that is kind of turning on the end. We see exposure to children where the virus in terms of symptoms and signs look and feel a little bit differently. So we have to be thinking in terms of evolving with the science, what we are actually experiencing. So there is a lot of good stuff that is coming out. And one of the questions asked, does the federal government not have some sort of relief for our hospitals? I'm sure we've probably heard some in the news, but I'm going to turn it to Rebecca. Have you heard anything?
So no, the answer is no. I mean, you guys saw the ship of mercy that went into New York City Harbor. That's about as good as that we have it. If I can leave you guys with something, in my life, none of the SHARE program, nothing that Santiago accomplished couldn't have been done with all these incredible nurses who had come alongside of us. And there were hard moments, Hannah, and you're going to speak to those as well. We had tough conversations. Like, we almost shut down. Did we move fast enough? Were we going to just move and give donations of PPE? Could we raise funds? Could we buy funds? Could we take on the risk of taking on materials that we didn't know were up to standards? There was a lot of tough conversations with really smart nurses out there that kept moving forward. And let me tell you, it would have been easier at any moment in time to throw up our hands and say, this is somebody else's problem. What we've seen in this crisis is there's one thing I can tell you, is that we cannot look towards the federal government to solve this issue. I wish we could. This is the first time, I think, in decades that we don't have a coordinated federal response on a pandemic of this kind of nature. And the reality is that we need smart healthcare leadership to take a voice and not be scared to go out there and publicly say. And just yesterday, I called Marion Leary after 3 nurses sent me private messages about what they were doing on the front lines of their healthcare systems. And I said, that's it. You and I have to start sharing this information on their behalf so they don't get fired. We are making a public call to say, write us, we will share it. A nurse from Tennessee is reporting this, because it is time that these voices are out there being heard. I spoke with a nurse yesterday who said, I have these butterflies in my stomach and I'm scared to go forward. And I said, every time in my life I had butterflies in my stomach, I knew I was on the right path, but it seemed like the wrong path because everybody else told me it was too hard or it wasn't the right thing to do. There are going to be 2 types of people in the world, and right now we need people that are going to take action. If you think somebody else is going to get us out of this box, if you think somebody else is going to fix it, if you have something that you can do, you have to do it. That is the only way we're going to see ourselves through this. And Hannah, I just applaud you for what you did, because the truth is that we need more people like you in the world owning this, because this is not just our lives, our people on the front lines. It's everybody in our lives that we love. And if we're willing to step forward to save them, if we help save them, we're going to help save others. So that's my advice to you guys. I couldn't have done it without anybody on the board of Santiago, all those incredible nurses. They pushed me, we fought, we made really good and bad decisions, and we're still here, and we're going to keep going. So Hannah?
Thank you for that. I will take the last word from Hannah for now, and then I want to kind of share a couple of thoughts on the chat.
Yeah, thank you. And Rebecca, thank you. I kind of want to piggyback on what you said, and I think we had kind of talked about this in a previous discussion. You have two kinds of people. You have people who are going to let someone else do something, or are going to do it themselves. And the first step is to choose to be the person who's going to do it. And then you have to get over the hurdle of fear of failure. You just have to do it, right? You're going to make mistakes, but if you make the effort to do something, to do good, you're going to make mistakes. But if you keep that bigger picture, as I was saying earlier, of why you're doing it, it's all going to work out in the end, and you're going to be able to help others and ultimately, hopefully, help society kind of get past COVID-19.
Thank you. This is a really enlightening webinar, I must say. And one of the comments coming in from Dean Van Pelt was, while many people globally have reviewed COVID-19 as an invisible threat, and notice I said invisible threat, as a nurse and for all healthcare professionals, it is frighteningly visible. A lot of what is being described is overwhelming. It has also created an incredible opportunity for discovery and innovation, which is truly free of traditional limitations. There is so much learning, innovation, creativity, and research that has included interprofessional and interdisciplinary collaboratives that would never have taken place, and we do agree with that. It is time to reimagine the future of nursing and the future of the healthcare professions. And again, a thank you to Hannah, Rebecca, for your passion and leadership. You are so inspiring. We started out with PPE, pandemic, pandemonium, and engagement for positive impact. I know you remember that. And I want to leave you with another PPE. You have heard stories of passion, stories of perseverance, and then enlightenment. So hopefully you have been enlightened today. And I hope that you have had a wonderful opportunity to ask. Thank you for all your thoughtful questions and comments. We have really learned a lot, and I will not stop. Beth Pitt said we learned about postural drainage back in the 60s. That's very true. And things have evolved since then. Everyone is saying how amazing that you all were. And I too will be so proud of both of you and of this opportunity. But I cannot stop by not saying a couple of last things. I want to thank Crosby, Enright, and Nathaniel O'Connell from the Dean's office who were in the background and really providing some of the services there. Hannah, Rebecca, our keynote speakers. Julie Norton, who is one of the senior development officers out of Bouvet, who were behind the scenes and arranged all of this. A big thank you. And if you liked what you heard, have been inspired by what you understood from today's webinar, please join us next time for broadening our understanding of contact tracing during COVID-19 with Dr. Neil Manier and others. So it has been a pleasure to have facilitated this session for you. Please stay in contact and continue to be part of the innovation to make a difference in this world. To all the nurses, don't stop working. It's the year of the nurse. Thank you to all.